Hello, welcome to ANA community. In this particular video, we are going to discuss the concept of Mamsavaha Srotodushti. In this, we are going to learn about Mamsavaha Srotodushti Karana, that means the causative factors which are responsible for the affliction of Mamsavaha Srotas, and Mamsavaha Srotodushti. So that means how to identify the affliction of the Mamsavaha Srotas in terms of the Lakshana, what we can say, the signs and symptoms, and Mamsavaha Sroto Viddha Lakshana. What are the symptoms that can be observed when there is injury to the Mamsavaha Srotas as such? When you think about the Mamsavaha Srotas, so that means which is actually carrying the Mamsa Dhatu in them. The main function of this particular Mamsa, as far as the main functioning of Saptadhatu are concerned, that is the Lepaha. So that means covering the human body. As far as the Mamsavaha Srotas are concerned, which is having the Srotomula, on one end it is the Vasa, and on the other end it is nothing but the Shat Tvacha. So that means there may be a possibility of entry of pathogen either in the Vasa region or in the Shat Tvacha region. Suppose if this is an organ, this is a Srotas, which is having the Srotomula as Vasa and Shat Tvacha. Suppose it is the having the organ 2, 3 and 4. In that particular situation, there may be a possibility of entry of pathogen either in the Vasa region or in the Shat Tvacha region. Suppose if the pathogens are entering via Vasa, there may be a possibility of affliction of Vasa first, which in turn may be having the affliction of organ number 2, 3 and 4, and later there may be a possibility of affliction of a Shat Tvacha. If the pathogens are entering via Shat Tvacha, then there may be a possibility of affliction of organs 4, 3, 2, and at last there may be a possibility of the affliction of Vasa. So that means, so depending upon the nature of the pathogens entering into the human body, the person may have an affliction of one Srotomula first, and later there may be a possibility of affliction of another Srotomula in due course of time. Now, let us look into the what are the Nidana of Mamsavaha Srotodushti. So, the Charaka says, Abhishyandi Bhojjani Sthulani cha Guruni cha Mamsavahini Dushyanti Bhuktva cha Swapatam Diva. If you split this, the Abhishyandini Bhojjani Sthulani cha Guruni cha Mamsavahini Dushyanti Bhuktva cha Swapatam Diva. Mamsavahini Abhishyandini Bhojjani Sthulani Bhojjani Guruni Bhojjani Bhuktva cha Swapatam Diva Srotamsi Dushyanti. So that means the Mamsavaha Srotas are getting afflicted if the person is going to take in excess regarding the Abhishyandi Ahara. Abhishyandi Ahara in the sense the substances which are causing the Srotorodha or Abhishyandi effect in the body, such as curds or fish. So Sthula Ahara, that means the substances which are consumed without proper mastication. Guru Ahara, the substances which are having the Guru quality in them. So that means the more amount of the time is required for the complete digestion. For example, the black gram items, etc. And Bhuktva Diva Svapna, that means sleeping in daytime after taking the food or after taking the lunch. That means having a nap post lunch session. So that is what we can say the causative factors considered to be responsible for the affliction of Mamsavaha Srotas as such. Now let us look into the what actually these Nidanas are. For example, if this is Abhishyandi Ahara, when you think about Abhishyandi Ahara, it is being mentioned in the Sushruta Samhita in the Dallana commentary. Abhishyandi Doshadatu Malasrotasam Atishaya Kleda Prapti Jananam. So that means that is responsible for the obstruction in the movement. So that means which are responsible for the Srotorodha in the body. For example, it is the Dadhi is one such example which is considered to be responsible for the Abhishyandi effect in the body. Sthula Ahara. So that means the consuming the food substances which are having the Sthula nature without proper mastication. If the person is going to take such kind of the food substances as is being shown in this particular example, there may be a possibility of Mamsavaha Srotodushti. Guru Ahara. The substances which are considered to be taking longer time for the complete digestion. So that means the substances are paired out of black gram, etc. So here one such example, if these substances are being taken, so that will be responsible for the delayed digestion in the body. Bhuktva Diva Svapna. So that means the nap after the lunch, taking the nap after the lunch. So that is the reasons. These are the reasons they are considered to be responsible for the affliction of Mamsavaha Srotas as such. Next, regarding the Mamsavaha Srotodushti Lakshana. What are the Lakshana or signs, symptoms are being observed when there is affliction of Mamsavaha Srotas? The Charaka says, Shudu Mamsa Pradoshajan, Adhimamsa Arbudam Kilam, Galashaluka Shundike, Putimamsa Alaji Gandamala Upajihvika, Vidyan Mamsashrayan. If you split this, Shudu Mamsa Pradoshajan, Mamsa Pradoshajan Shudu, Adhimamsa, Arbuda, Kila, Galashaluka, Shundike, Galashaluka, Galashundika, Putimamsa, Alaji, Gandamala, Upajihvika, Vidyat, Mamsashraya. These are the Lakshana that will be observed if there is affliction of Mamsavaha Srotas. Adhimamsa refers to excessive muscular growth. Arbuda, it's a tumor. Kila, so that means it's the swelling which is having the pedunculated form. Galashaluka, that is the tumor observed in the throat. Galashundika, the swelling arising from the uvula or soft palate. Putimamsa, that is the dead or decayed flesh. Alaji, a disorder of the eye afflicting the sclerocorneal junction. Galaganda, the neck swelling on the anterior side, or otherwise thyroid swelling. Gandamala, the group of the swellings present around the neck. Upajihvika, the disease afflicting the uvula or epiglottis. So these are the Lakshana that will be observed in cases of Mamsavaha Srotas affliction. This is an example of Adhimamsa. Extreme left, it is Mamsakshaya, that is indicative. If the person is doing the regular exercises, for example, exercise about 20 minutes continuously, daily for 21 days or so, or more 30 days or so, then the person may have what you say that the excessive muscular growth. Arbuda, either there may be a possibility of either benign tumors or malignant tumors. Kila, that is a pedunculated swelling. So here the swelling that is having what you say that this is what we can say the narrow structure connecting the body and with the other side with the tumor. This is what is considered to be Kila. Galashaluka, it is a swelling observed in the throat region. Galashundika, that is the swelling observed of uvula. So this is the what is considered to be the part of the soft palate. So that is the Galashundika. Putimamsa. So here that is what we can say the pus accumulation observed in this particular example. That is what we can say the Putimamsa. Alaji, the affliction of a sclerocorneal junction. Galaganda, so neck swelling, specifically observed in the anterior side. That is the thyroid gland swelling. Gandamala, it is a group of the neck swellings. So specifically the lymph node swellings. Gandamala. Upajihvika, that is affliction of either uvula or otherwise epiglottis affliction are categorized under Upajihvika. Then, what are the Mamsavaha Sroto Vidha Lakshana? If Mamsavaha Srotas is getting injured, what lakshanas are being observed? So Shruta says, Tatra Vidhasya Shvayathu Mamsashosha Siragranthi and Marana. So the four lakshanas are being mentioned. Shvayathu, that is swelling, will be observed. Mamsashosha, atrophy of the muscles. Siragranthi, that is the swelling observed in the blood vessels itself. So here the example is aneurysms of aorta, etc. Marana, death may also be possible. Shvayathu, there may be a possibility of either localized or generalized swelling. Probably this can be attributable to what is that hypoproteinemia as such. Mamsashosha, extreme emaciation. Siragranthi, so that is the trauma to the aorta, etc., wherein the there may be a possibility of erosion of the bones also. So that is the Siragranthi as such. Marana, the death also may be possible. This can be attributable to either hypovolemia or either severe electrolyte imbalance, or either there may be a possibility of elevation of serum creatinine or chronic renal failure. These are the other uh, modes of death that may be possible when there is Mamsavaha Srotodushti is getting injured. Take home messages from today's discussion are Mamsavaha Srotas is mainly concerned with life support in terms of Lepana karma, that is covering the body as such. Vasa and Shat Tvacha are considered to be afflicted in case of Mamsavaha Srotodushti. As far as Nidana are concerned, Abhishyandi Bhujjani Sthula Guruni cha Mamsavahi Nidushanti Bhuktva Diva are considered to be the Karana or the reasons for Mamsavaha Srotodushti. Whereas the Mamsavaha Srotas are injured, then are afflicted, then Adhimamsa Arbudam Kilam Galashaluka Putimamsa Alaji Gandamala Upajihvika are being observed. When there is injury to the Mamsavaha Srotas are happening, Tatra Vidhasya Shvayathu Mamsashosha Siragranthi Maranamcha are observed when there is injury to the Mamsavaha Srotas. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners or true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.